So today we're going to talk about local control of blood flow. On this side, we have control of the blood flow to the system. On this side, what we have is we have control of blood flow to the organs. Okay, this right-hand side, basically local control of blood flow. So the mean arterial pressure, that's extrinsic. That's for the whole system. Okay, you're going to regulate that using the total peripheral resistance, TPR, and that's the general or overall vascular tone, and also by changing the heart rate. And recall that mean arterial pressure is cardiac output by total peripheral resistance, and that cardiac output is stroke volume and heart rate. So that's basically how you're maintaining that mean arterial pressure. And that maintenance of mean arterial pressure is by nervous control and hormones. The sympathetic plays a huge role in that, to increase the mean arterial pressure by vasoconstriction initiated by norepinephrine. The parasympathetic, not that important in blood pressure. It causes vasodilation of sweat glands and the reproductive glands by using nitric oxide or NO. The main focus of the lecture is this local control of blood flow, the intrinsic auto-regulation of blood flow to the organs. So there's an organ here and there's an organ here. And you can control that vascular tone to deliver blood to those organs by these little orange dots. Those are the resistance arterioles. So you can vasodilate, vasoconstrict, and you can change blood flow through the capillaries of those organs using those resistance arterioles. So the perfusion to those organs with local control of blood flow is controlled by the organ's needs. Okay, so if the organ is exercising, etc., needs more oxygen, you will increase that blood flow. You also have effects of blood pressure, and we'll talk about that as well. But it's really important to note that as long as the mean arterial blood pressure is okay, you can have autoregulation in the tissues. Okay, so it's a really important point. The tissues in which local control of blood flow play a really important role is the kidneys, renal, where you have glomerulotubular feedback for blood flow to the glomerulus. The cerebral circulatory system, and that's controlled by the concentration of carbon dioxide and H+ ions or acid. Okay. And then also you have the heart system, the heart circulatory system, which delivers blood to the myocardium. So all of these three different organs, the local control of blood flow is extremely important in those organs. Skeletal muscle, the local control of blood flow is moderate, and the local control of blood flow to the skin, that is little to none. So the most important tissues are the kidney, the brain, and the heart in regards to local control of blood flow. So let's look at the mechanisms involved in local control of blood flow. The first one, we have the metabolic theory, okay, where vasodilatory metabolites, autocoids, or endothelial secretions released by that organ cause a change in blood flow to that organ. Within this metabolic theory of increasing blood flow, you have active hyperemia. So hyperemia means hyperemia, increased blood flow, so active hyperemia. You have increased blood flow with an increased number of metabolites released from that organ with activity. Okay, so you have increased blood flow with activity of that organ. And that blood flow, the change in blood flow, is proportional, okay, to the metabolite concentration. So if we look at this graph here, this is flow on the y-axis and time on the x. And we have a basal flow here, we have an activity, and at the point where the activity increases, metabolites are released and blood flow starts to increase. When that activity stops, then that blood flow returns back to normal. And this happens during exercise in skeletal muscle, when you're digesting food in the gut, or in the coronary vessels, or in the heart. Okay, so this is the active hyperemia. The second way that you can increase blood flow under this metabolic theory is reactive or ischemic hyperemia. So it's reacting to something, or it's following ischemia. So you have a transient increase in blood flow after a brief period of ischemia. And this ischemia where the blood flow is blocked for a short period of time. So during a period of hypoxia, you get a buildup of vasoactive metabolites and the hypoxia itself, and what those cause vasodilation of those blood vessels, and those blood vasodilation will decrease the resistance. So when blood flow is resumed by releasing that blockage or preventing a blood flow, you can get an increase in blood flow, okay, to that tissue or organ when you remove that ischemia blockage. So diagrammatically, what we have here, we have flow again, and we have time. And this point here, we have ischemia. Okay, so we're blocking the blood flow for a short period of time. Okay, you can see that the flow is completely blocked. And then once you release that block, then you're going to have an increase in blood flow. And again, the amount of blood flow is proportional to the length of that ischemia, as long as the tissue is not damaged. Okay. And examples of this reactive or ischemic hyperemia is, for example, when you remove a tourniquet, okay, or you unclamp an artery during surgery, or you restore blood flow to coronary artery after you remove a cannula that's been put in there. So we have these two metabolic theory mechanisms. You have active hyperemia and reactive hyperemia. Active hyperemia is basically you have an increase in blood flow with an increase in activity of that tissue. For the reactive ischemia or the reactive hyperemia, you're going to have an increase in blood flow following a period of ischemia. Okay, so the second mechanism is the Baylis myogenic response, or basically the myogenic response, where you have an intrinsic response of the vascular smooth muscle to an increase in pressure. So that increase in pressure is going to stretch that vascular smooth muscle. It's going to stretch it. Okay, then you're going to have a reflex contraction of that muscle. It's going to reflex and contract. You're going to increase the resistance. You're going to decrease that radius, and you're going to decrease that flow across the arteriole. So this response is really important in the kidney and the brain. Okay, and what we have here is where flow, represented by Q, is equal to delta P over R. Okay, so the flow, blood flow is equal to that pressure gradient across the arteriole, so that delta P over the resistance R. So if the pressure increases, okay, you're going to increase that resistance by contraction, and you're going to decrease that flow. Okay, so that's the myogenic response, or the Baylis myogenic response. And let's look at that graphically. So on this graph here, we have flow on the y-axis, and we have pressure on the x. And we have 60 to 80, that's the lower limit of the regulation. Different texts have different values, and 150 is the upper limit. Okay, so what we have here is normally, okay, you would expect the flow to increase, shown in orange, as the pressure increased according to this equation, okay, where flow is equal to delta P over R. But that doesn't happen. What happens in organs such as the kidney and the brain, what happens is you have regulation within a range of pressures. So between 60 and 80 millimeters of mercury up to 150 millimeters of mercury, you have a regulation of the flow. Okay, so as the blood pressure drops too much, okay, if we go in this direction and the pressure drops, we're going to have dilation. We're going to decrease the resistance, and we're going to increase the flow. We're going to decrease that resistance by increasing the radius. So basically more blood can flow in to that organ. However, if the blood pressure increases too much or goes in this direction, we're going to have vasoconstriction, okay? And we're going to increase the resistance by decreasing the radius, and we're going to decrease the flow. So what happens is that you regulate the flow within a range of pressures, okay? So the pressures start to go too low, vasodilation, you increase the flow to that organ. Okay, if the pressures start to increase too much, you have constriction, and you reduce the flow as the pressure goes up. So you regulate the flow, okay, regulate the flow to that organ over a range of pressures. And why is this important? Well, in the kidney, you want to control filtration. Okay, if the pressures go too high, you're going to increase filtration, and that's not going to be good. If the pressures go too low, you're going to reduce filtration. So you want to regulate the blood flow to the glomerulus in the kidneys at a constant flow. The brain, on the other hand, you want to control the volume in the brain. Okay, so the brain is a closed box, and if you have too much fluid, too much flow coming inside that brain, it's going to press against the blood vessels in the brain, okay, and cause a lot of problems. So this is the myogenic response. It's an intrinsic response of the muscles due to changes in pressure, okay? And based on this graph over here, you're going to use that myogenic response to auto-regulate the flow of blood over a range of pressures. So what we're going to talk about for the last part of this lecture is vasodilators and vasoconstrictors. Okay? So in the first part we have epinephrine, okay, in the systemic system. It binds to beta-2 receptors, causes vasodilation, decreases total peripheral resistance, and increases heart rate. And it primarily causes vasodilation in the liver and the skeletal muscle, where you want to increase blood flow to those organs when you have increased amounts of adrenaline. Bradykinin is involved in pain, released locally. Histamine, released from mast cells, causes inflammation. We have the prostaglandins, prostacyclin and PGE2. We have potassium, elevated potassium levels during, for example, increased muscle activity, has a paradoxical effect. Okay, pay attention to this. The paradox is that when you have elevated potassium levels, you'd expect depolarization and muscle contraction, and that does happen in skeletal muscle. In smooth muscle, we have a special potassium channel that responds to the elevated potassium concentration, and what happens there is you have a hyperpolarization of the membrane potential, and you cause a relaxation of the smooth muscle. So potassium is a vasodilator. Nitric oxide, NO, is produced locally by endothelial cells, and you can see the slides for more details. There's a lot more information on there and better diagrams than I could draw, so please see the slides for details. Then we have magnesium, sodium, hydrogen ions, carbon dioxide, and hypoxia. They all are vasodilation, with the exception of the lung for hypoxia, and you'll cover that later. Vasoconstrictors, epinephrine in pharmacological doses. It switches from a beta-2 to actually an alpha-1 and causes vasoconstriction, okay, and pharmacological doses. But under normal concentrations, okay, it causes vasoconstriction in the skin and in the splanchnic circulation, the gut, okay, when you release adrenaline. Norepinephrine, okay, it binds to alpha-1 to increase the total peripheral resistance, binds to beta-1 to increase the heart rate. These two together cause an increase in mean arterial pressure. But later on, what happens is the mean arterial pressure will decrease because of the baroreceptor reflex will decrease the heart rate. So that's norepinephrine. You have angiotensin II, vasopressin. You'll learn about those later. We have other prostaglandins that cause vasoconstriction, thromboxane A2 and PGF. So these are different than these prostaglandins over here. Okay, so note that difference. Serotonin, it's released locally from the platelets. It can cause vasospasms when it's inappropriately released in the brain. Can cause vasospasms with subarachnoid hemorrhage. And also in the heart, with inappropriate release, you can get vasospasms. So in this local control of blood flow, these different metabolites and compounds, they can either work locally, they can either work in the whole body system or paracrine. Okay. And please see the notes for these different details. So in local control of blood flow, we have two things. We have control the mean arterial pressure, and we have the control of flow to the organs. Mean arterial pressure is extrinsic. Local control is intrinsic or autoregulation. And that mean arterial pressure is normally kept constant, and when that mean arterial pressure is okay, we can have local control of blood flow. If that mean arterial pressure is not okay, then the control of the blood pressure to the whole body is going to take priority over autoregulation. But as long as the mean arterial blood pressure is okay, you have autoregulation occurring.